So what we're talking about here is kind of a mid-moderate stage bunion deformity. This patient is reporting pain pretty much all the time, not only in shoes, but some aching and discomfort even when this person is barefooted around the house. There's a family history of bunions and a recent bunion surgery from a parent, and there's a concern that this is going to get worse, and what are the options for treating it at this point? So we were just starting to talk about that. So being in a mid-moderate stage deformity, talking about surgery specifically for the moment, the surgery is much less extensive as compared to a much more severe deformity. The recovery is much shorter, and there's much less internal hardware. What does that mean? For bunion surgery, very oftentimes we use things like screws and plates and staples all inside the foot to hold the bones together after we move them. For a surgery like this, maybe one screw or two screws, probably, and they're inside the bone. And so if I didn't tell you that they were there, you would never know that they were there. The purpose of the surgery would be to realign your big toe joint here and give you a straighter big toe, and also just kind of shave off the bump over here so that when you're done, your foot will look kind of something like this, with a small incision and ultimately a scar right here. Patients ask me all the time, does it make sense for me to do this at a stage like this, or should I wait till it really hurts more or that the deformity gets much worse? Bunions are one of the few things that I say, the earlier you can do it, the better, for the reasons that I said a few minutes ago. Shorter recovery, less hardware, less extensive surgery. The procedures increase dramatically as the deformity gets worse. So that's kind of an overview as to where you are, and I'm happy to answer questions and talk about it with you.